Hello everyone. This tutorial introduces time-saving literature search strategies and techniques. By the end of this tutorial, you will be able to use PICO method to formulate answerable questions, translate them into search queries, and learn PubMed search basics. Let's suppose that your neighbor friend, Miss Johnson, has an 18-month-old baby who needs to take the MMR vaccine. She heard reports that the MMR needle might cause autism. She Googled and found 120,000 results. She was scared by the statement, quote, "My child fell into autism directly after his 12-month measles, mumps, rubella vaccine," end quote, in the first article. After spending hours of reading her Google search results, she was confused by the controversial discussions and wanted to find the best evidence published in scientific papers. Thinking of you as a pharmacy student, she called you for help. You choose PubMed Medline as your first choice for primary literature search because PubMed Medline, developed by the National Library of Medicine, covers broad subjects in biomedicine, health, and life sciences from 1946 to the present, and provides access to reliable and up-to-date tertiary and primary literature as well as clinical trials information. Asking the right question is fundamental for you to formulate a search query and find what you need. As you want to find evidence-based information, you decide to use PICO method to help you formulate a clinical answerable question. A well-built clinical question should include 4 parts, which we will call PICO. P stands for patient, problem, or population. I is for intervention. Is it a drug or surgery? C means comparison. Do you compare it to placebo? To different drug in the same class? It should be specific and limited to one alternative choice in order to facilitate an effective search. O stands for outcome. Is it better or worse or the same with the intervention? Specific outcomes will yield better search results and allow you to find the studies that focus on the outcomes you are searching for. Your question is whether there is a link between MMR vaccine and an increased risk of autism in infants. Using PICO method, you identify P is infant, I MMR vaccine, O autism. There is no comparison in this question, so your search concept terms are infant, MMR vaccine, and autism. Once you formulate your PICO question, you will go to PubMed and translate it into a PubMed search query. In PubMed search, you need to identify concept terms, then combine search terms or statements using Boolean operators like and, or, and refine your search if the results are not satisfied. You can refine your search by using PubMed filters, mesh database, adding search terms or synonyms, exploring terminology in search results, and finding appropriate terms that might help you get better results or conduct a phrase search. You will learn how to use filters and create an efficient search in mesh database tutorial. You have identified concept terms using PICO and now need to choose the right Boolean operators for your search. In this diagram, you can see that MMR, or measles, mumps, and rubella, will retrieve articles about either MMR or measles, mumps, and rubella. MMR and autism will retrieve articles that discuss both MMR and autism. MMR not autism will exclude records that contain the term autism. Remember, PubMed will automatically combine your terms with and. and takes precedence over or. Use parentheses to group your or terms. Searching phrase with quotation marks will help you find exact phrase in search results. For example, if you search heart attack, you will get 206,308 citations because PubMed looks for citations that have keywords heart and attack, myocardial and infarction, and also retrieves citations that were indexed as myocardial infarction to enhance your search results. If you search heart attack as a phrase using quotation marks, you just retrieve citations with the exact phrase heart attack, and thus the results drop to 3,264 citations. You can see there is a huge difference in search results. Conducting a phrase search helps you get more specific citations, but also excludes some interesting ones. Now you'll start your PubMed search to find evidence-based information for Ms. Johnson. Remember to access PubMed. Go to Schiffman's website and click PubMed at Wayne. From PubMed at Wayne's site, you can download or order full-text journal articles directly through your search results page.